Most of you are familiar with using Botox to treat wrinkles and lines. Today we're actually going to use Botox to treat a case of a patient who experiences excessive sweating. So as you know, sweating is the way that we regulate our body temperature. So in these patients, they just sweat too much. So what we're going to do with this procedure is inject the Botox to just turn down the sweating. They'll still sweat some, but we're going to make them sweat normally. So what we've done to prep the skin is we're going to treat her axillary area. And so what we do is we paint the area with some iodine, and then we put a little starch or baby powder on here, and that highlights the areas where she tends to have a little more concentration of sweating. So after the patient's prepped, we're going to treat this area. She has had topical numbing cream applied for about 30 minutes prior to the procedure. Basically, this whole area in the axilla is filled with sweat glands. So we're going to cover the area with just a small series of pinpoint injections. Very well tolerated by patients. And one of the things that's different when you use Botox for sweating, it actually works fairly quickly, so usually she'll notice in about a week that the sweating is greatly diminished. And most of the time, this treatment lasts longer than it does for when we treat wrinkles. So typically, a wrinkle patient gets improvement for about 4 months. When we use Botox for sweating, we usually get improvement anywhere from 6 to 12 months. So many patients just come once a year for follow-up treatment. Most of the patients, by the time they get to our office, have tried some of the other procedures and devices that are available over the counter. There are a couple of topical prescriptions. There's one oral tablet that can be used. The problem with those treatments is the topical treatments often are very irritating, so patients will end up with a rash. And some of the oral medications just cause a lot of problems, such as dry mouth, dry eyes, so they're not easily tolerated by patients. So this treatment has really been a great weapon to add into our arsenal to help with this. The other alternative is there is a major surgical procedure that patients can also do, but I think most patients find that this is a very easy way and doesn't require major surgery. So when we're all finished, then we'll just cleanse the area, and then she's really good to go. I usually have her not wear deodorant immediately after the procedure, but then she can go right back into normal activities.